Hi, Stefan, Iron Direct Primary Care, and today we're going to be talking about our 2024 update on how we should be testing micronutrients. So this is the micronutrient panel with Vibrant America. It's a new lab we established a contract with. And what separates this from other panels is that typically you'll have gotten a serum blood draw where that looks at essentially what is in your blood at that current time. The white blood cell micronutrient analysis, it looks at a 30-day average of your nutritional status. So I think this should be now the gold standard here at Iron DPC for assessing nutrition. It's not with urinary metabolites, which is an assessment of how much nutrient you're excreting in your urine. And it's not with serum testing, which is, we've done those before with like your B12 level or your vitamin D level. But this really just tells you, really in vitamin B12's case, if you've been taking your supplement in the previous days. So let's look at my micronutrient level, and we're going to go down a little bit further to the comparison, because this test not only looks at white blood cell, it looks at serum values as well. So this is my vitamin A level, and you can see vitamin A is pretty equivalent in the serum and white blood cell, and that's probably because it's fat soluble. So a fat soluble vitamin like vitamin D or vitamin A, it might be sort of decent marker in a serum panel. But regardless, I'm very good on both vitamin A's. It's because I do supplement with vitamin A in a multivitamin as well as eat it in beef liver. Vitamin B1 is also very good. I supplement with this one, but I'm going to get it in beef. I eat ground beef a lot. So both my white blood cell nutrient status and my serum is very good. Probably serum a little bit higher because I was taking it in a supplement form at the time. B2 was oddly a little bit low. Any comments, Logan? Do you have any idea why mine might be low?
That one ends up being low in a lot of people. I know it has to do with mitochondrial function and trying to metabolize fatty acids, from my understanding. So perhaps people just need a lot more than we think we do, or we're burning through a lot of it, but that's riboflavin. So that could be part of it. I mean, you do a lot of high intensity exercise, stuff like that, so you could be burning through a lot of it too.
It's a possibility. Now, B3 or niacin is interesting because I have been recently doing a sauna detox protocol where I'm taking 500 milligrams of niacin. You may have seen pictures of me on Instagram. I'm beet red from this. I look like a tomato. And as part of this mercury detox protocol, so I take niacin about 40 minutes before going into the sauna, and it opens up all my capillaries, improves perfusion. But as part of this mercury detox protocol I researched, I'll do that and sometimes also combine a zeolite clay binder for this mercury detox protocol.
Yeah, your serum's high.
Yeah.
Vitamin B3.
Yeah, it's because I had been supplementing with it. But overall, my niacin is actually kind of low on average. And this was in accordance to what I had noticed previously in a LabCorp serum niacin, is because my serum niacin had been low previously. So, yeah, I might just be low in B3, which is very interesting. I have a whole lecture here on the YouTube channel about nicotinamide or niacin deficiency playing a role in pretty much most of disease states throughout history. Niacin has been implicated in the rise and fall of civilizations, essentially, where there was famines and feasts. When civilizations would go into famines, this would typically be a meat deficiency or NAD deficiency. I'm not quite certain why my white blood cell might be low. I do eat a lot of meats. It's mitochondrial energy is what NAD is, or NAD precursors, such as in the form of niacin. It's also implicated in the aging process. So potentially supplementing with niacin precursors, or NAD precursors like NMN, NMR, or niacin might support that energy substrate. So I might get back on the True Niagen supplement because of that. B6, a white blood cell count was also a little bit low on this one, a bit odd. Now this might be from my gut microbiome. A lot of these B vitamins can be produced by microbes in my gut. So that's next, is we're going to be assessing my stool microbiome testing.
You also use B6 for a lot of things, like neurotransmitters, a lot of the biochemical processes you use B6 for. So I think it's just like some of the other stuff. You need a lot more than you think you do.
Yeah.
A lot of us, even if you have the perfect diet, you still might need to increase the amount supplementally that you're doing with some of this stuff.
Yep.
I mean, you can be on point, and I think we just need sometimes a lot more than we think we do.
We do need a lot more because we're exposed to a lot of toxins
Yeah.
on a daily basis. Right? I identified in another test that I had MTBE in my blood, which is a jet fuel runoff. We do live near the airport, and I'm pretty sure we're getting jet fuel contamination here. And then we're exposed to other things. We're exposed from chlorine and fluoride in the tap water. And just a lot more pollutants. We're breathing in exhaust fumes all the time. So we need a lot more of these things that help us detoxify.
Well, and we're talking about optimization too. Like people can function with a low number of any of these things, and they're still going to probably function relatively normally. But this is also like optimizing.
Correct.
Right? So this is like the fine tuning.
Yeah. We don't want to wait till the disease state manifests. We want to optimize things so the disease state never even comes into being. A lot of the reference ranges have been identified based off disease states, at least the serum reference ranges. Here's B12, and again, I'll have patients will do a serum lab with LabCorp, and they'll see that their B12 level is greater than 2,000, and they get super concerned about this. Like, well, you were taking a supplement. Did you take your supplement? Yes, I take a lot of B12. Well, your serum is going to be high, and I do take a B12 supplement. But here's my white blood cell average, it's dead average. So despite taking supplements increasing my serum level, which is really just telling me if I was taking my supplement that week, my white blood cell count is great. If even I think it's average, I would like it above average. So maybe you need to take more. B5, pretty average serum. Could do better on white blood cell count. Vitamin C is low in the serum, indicating I perhaps wasn't taking it in the previous days. My average is below. I would like this better, and since this test, I've increased my vitamin C, taking 1 gram 3 times a day, or at least twice a day now. And that's because I want more of that antioxidant there, specifically because I am taking more iodine now. When you take more iodine, you should increase your antioxidants. Here's vitamin D3.
That's pretty good.
And vitamin D25OH. Now, the vitamin D25OH is what we test typically with LabCorp. So we're used to seeing this one. And 85 is a very good level. I like to see myself at 85. That's really perfect. I was at like 100 and I think 40 previously with LabCorp because I was taking a bit maybe too much. Didn't have any side effects from that. But the reference range is anywhere between 30 and 108, but I like to see patients up here between like 80 and 100. So I have a very tight cutoff for vitamin D, and that's because we've identified in the literature that having high vitamin D levels above 70 decreases cardiovascular disease, dementia, depression,
viral illnesses.
Your illnesses go down. So all patients need to monitor their vitamin D levels. There's something interesting we identified about vitamin D is that patients who are fatter need more vitamin D. It's fat soluble, so if the patient is bigger, they need much higher doses of vitamin D. So for myself, I can take 2 drops of that vitamin D3K2 supplement by Bioprotein, 2 drops a day, and I can get to this level. I was taking,
which I think that's what, like 4,000 IU.
I believe that's 10,000 actually.
Is it that much?
It's that much in 2 drops. Plus, I was taking in a multivitamin, about 1,000 milligrams a day. So that's about 11,000 units total. And that got me here. I was taking 5 drops of that previously, and it pushed me up to 140. Now, I'll have patients, they'll be doing 4 drops of that product, and they're barely hitting 40.
Wow.
Yeah, and these are patients that are not as lean as I am. They're a bit bigger. And so they may need actual injections of vitamin D to get them up to a good level.
Yeah, I think I do the liposomal. It's an oral with K2. It's only 5,000 and got me up to like 90. So I guess it's,
we actually have good decent sunlight exposure too. We get out in the gym. We have an outdoor gym we train at. And then vitamin D3, we also got this one. They added this one on, and that tests both serum and white blood cell. So you can confirm this level as well and make sure it's optimized. And We're also very good in this. Here's vitamin E. So vitamin E, I might be getting that from fish oil. I've been consuming a decent amount of fish oil now.
Probably the phytomulti probably has a little bit too.
The phytomulti I was consuming has a bit of that as well. The serum was low, potentially indicating I had missed some supplementation. But my white blood cell count was pretty low. It was pretty good on vitamin E. The vitamin E is known as a plaque stabilizer. And that's one reason people may want to take vitamin E and make sure it's optimized. Not that I have plaque, but it's something good you want to make sure you have to sufficient levels.
Also helps with skin elasticity.
Skin elasticity. Here's vitamin K1. So vitamin K1 and K2, which is also here, they were a bit low for myself. Now, vitamin K2 is in the vitamin D supplement that I take, but both of these are low. So since then, I started taking a K1 and K2 supplement. Now, why are these important? Well, they're implicated in deficiencies in forming calcium plaquing in the arteries. Now, I had a coronary artery calcium score done when I was like 29, which is not a big deal. Not going to see anything there. It was 0. But that's kind of like a baseline for myself to monitor this over time. And really, the reason calcium plaquing may form is from K1 and K2 deficiency. So I actually have changed my mind on the coronary artery calcium score. I don't think it's a very useful test at predicting coronary artery disease. The only thing it's good for is determining if the patient is K1 and K2 deficient, and if they've been deficient for a very long time, and they develop calcifications. They can develop calcifications in their aorta, their arteries. Heck, they can get it in their joints, their knuckles, anywhere. So it's a reason you would want to take vitamin K1 and K2, which really you should get from if you're eating grass-fed beef. It should have a good K1 and K2 profile. I was surprised to see mine was this low. The other reason it can be, again, abnormal microbiome. And the microbiome isn't producing it for you.
And you can get the K1 and K2, K1 specifically too, from fermented foods. So sauerkraut has some K. Nattokinase, I know nobody likes the taste of that, but that has K2 and K1. So if you up the fermented foods too, which we recently started doing quite a bit of ferments, so perhaps that'll improve.
Hopefully that would improve it too. But I've also started taking a supplement for this too, added it into my protocol.
Folate's really good.
Yeah, folate's very high. And I'm not concerned about this super high level of folate.
No, it's probably good.
I'm getting this obviously in the multivitamin, getting it from beef liver, from beef itself.
Yeah.
Well, that's probably where I'm getting it.
When a low folate can cause a lot of issues.
Yeah.
As we know. So it's good.
Calcium level, white blood cell count, very good. Serum, again, a little bit below average, but the white blood cell count is the most important component of that. Manganese, a little mineral. Not a lot of people think about this one. A bit low in the white blood cell count of manganese. So I'll probably add some more trace minerals. Since this test, I started adding more trace minerals.
That's also in beef liver.
Is it?
Yeah.
Interesting.
Manganese.
That'd probably be only if the cow is eating manganese.
Yeah. If the soil's depleted, I don't know where they're going to get it from.
Right. We got a cow from Skeeter Farms in Okeechobee, and this thing was supposed to be grass-fed, supplemented right. So potentially just eating this cow might improve this micronutrient panel. Over before, where was I getting beef? Costco, for the most part. Here's zinc, again, high in the serum. People might get a little bit worried about that, but again, serum is just a marker of whether you took your supplement previous day, and I did. I was taking a zinc supplement about 15 milligrams a day. My white blood cell count is decent, right? Kind of average. Copper is interesting too. So copper deficiency has been implicated in graying of the hair. So not something you want to be deficient in. You want a proper ratio of zinc to copper. My ratio in the serum at least was a little bit off this day. But overall, if you look at the white blood cell average, it's good average of copper and zinc. Chromium, serum. So we didn't get a white blood cell count on chromium. Wonder why.
That's good for sugar control.
Sugar. Iron, again, a little bit low in the serum. but average red blood cell. So it
Mhm.
looked at red blood cell iron, which is again intracellular.
Well, and I feel like that iron level isn't necessarily poor either, because you don't want to have a high iron either.
No.
High iron's inflammatory, so you don't.
Yeah.
I mean, you don't really necessarily want it at the top of that reference range.
No, you do not. It's going to deposit on your liver, and it's going to cause liver disease. If you have high iron, you need to donate blood to the Red Cross.
Mm-hmm.
Magnesium.
Good. Yeah.
Yeah, so we looked at red blood cell magnesium, and if I do order this, even with LabCorp, I'm ordering red blood cell because serum is fairly useless, although this one wasn't bad. Red blood cell magnesium, very good average there. Again, ignore the copper to zinc ratio of serum. You know, people might get panicked about this, but again, I was just taking a supplement the previous day. Choline. What's choline good for?
Phospholipid membranes. In women, it's important for babies. So, yeah, I would say building cell membranes. It's important for.
And inositol, very low, healthy.
Inositol is one also that can help regulate blood sugars in women with PCOS.
Mm-hmm.
So both of those, I mean, they're important for everybody, but especially somebody of childbearing age or who wants to get pregnant, who is pregnant. Choline's a major one that you don't want to be deficient in, because that's, again, going to be one of the building blocks of all the cell membranes. So if your choline's low, you can imagine you're not going to have a very steady cell membrane in the developing child.
I should probably supplement with it. It's kind of low.
Eggs are high in choline, which is interesting because I feel like you eat like
I eat a lot of eggs.
4 eggs, but it's like we're looking at optimization. So like, are your numbers low? No, but you'd like to see them a little bit better.
Maybe feed the chickens more inositol, so I don't have to take the supplement.
Feed the chicken. Oh, okay. I mean, I
Put
guess
in something.
Well, the choline comes from the eggs.
Yeah.
The inositol is not coming from eggs.
Maybe we supplement them, and then I could get a byproduct of eating the eggs.
Mm-hmm.
So carnitine, I actually asked Dr. Tinney, why was my carnitine so low? And his theory...
Mine was low too.
His theory was that because I'm so lean, so carnitine is a fat transporter. And so, sometimes as a protocol for patients trying to lose weight, I actually have them inject carnitine prior to the workout because it will improve fatty lipid transport and help them burn fat more. Mm-hmm. But Dr. Tinney was of the mind that because I'm so lean, my carnitine is low because I have low need to burn fat as a lipid transporter.
Interesting.
I like that take.
Is that methylmalonic acid?
Yes.
MMA? Yeah, so actually that's a byproduct of B12, which is interesting. So you probably still need more B12.
Yeah.
Because that's usually a byproduct of that. If it's
that.
high or it's low, usually it means you're still not getting enough B12.
I'm not getting enough.
Because it's a part of the methylation process. So there still might be an area where you're maybe not methylating as well. And so that's why that's low, which again just means still need more B12. So it's like we might still need way more of something than we think we do.
Yeah.
To optimize. It doesn't mean you can't live at that level, but if you want to feel your best, you want to optimize, you want to have the best outcomes, then you look at this type of testing.
Sodium, potassium, again, this is a serum testing. This will vary day to day. Get some amino acids here. Asparagine. A little bit low. And all these amino acids were actually a little, glutamin's okay. But the other amino acids were low on myself.
And you don't supplement with them?
I hadn't been doing that before.
You haven't been good with your collagen?
No, so I'm not good about doing powders. So I've put an amino acid.
Oh, that's right. You did start the aminos.
Capsules. Yeah. I put it in my supplement. I doubled the recommended intake as well on those. So I'm taking it twice daily. Serine, arginine. It was a serum test. Serine was low. And we have citrulline, not bad. Isoleucine, again a serum test, below average. Valine, below average. Leucine, below average. CoQ10, very important one. average. Again, the serum test was a bit low, but averaging very good CoQ10, which haven't eaten much beef heart recently, but probably getting it from beef itself. Yeah. Very important mitochondrial nutrient. Anyone taking a statin needs to pay attention to their CoQ10 levels. Cysteine is the precursor of glutathione. I've struggled for some time with low cysteine and low glutathione levels and low glycine levels, so this just confirmed that I needed to take more. So I was taking, I think, 1,200 milligrams of NAC prior to this test. So I increased that to 1,800 milligrams. Plus, I started taking exogenous glutathione because this is now the third or fourth time I've tested low in glutathione.
Well, and that could just be the precursors, right? Because you need glycine, you need cysteine, and what's the other one?
Glycine and cysteine primarily.
Or is it just primarily those two?
Yeah.
So if you're low in those,
yeah,
by proxy, you'll be low in glutathione, which is a pretty easy, I mean, it's an easy fix. You're just bringing back the building blocks.
Yeah.
So for most people, at least if they're doing like a collagen peptide that has all of these, you should be hitting a lot of these. You may still need others. And exercise really depletes your glycine. So like, for example, that was the only amino acid my dad was low in, but he did a really intense workout right before. So that might have been why he just depleted all his and you do a lot of high intensity exercise too.
Never before these testing. These were all done in the morning. So yeah, that's what I said. 3 times I've tested low in glutathione.
Yeah, well, you just might need a little bit extra.
I may need a lot more.
Yeah.
I do train pretty intensely every day.
Yeah.
I may have to inject it too on certain days when I train super hard. I think injectable glutathione is the most efficient way of getting it into the body. Orally, it doesn't work unless you do liposomal. And precursors would be the best way. So even if you're doing supplementation with glutathione itself, you have to do the precursors as well. You have to do the NAC, you have to do the glycine. Selenium. So this is interesting. I take selenium pretty much every day, except before this test. I ran out of my selenium supplement.
That is really interesting.
So my selenium, very low. And this is implicated again with oxidative stress, graying of the hair. Selenium is critical towards thyroid function. So you want to make sure you have a good average of your selenium. It's also critical when you're taking iodine to make sure you're taking selenium as well. Again, it's that antioxidant. It's going to buffer the thyroid peroxidase and that stress on the body. So I'm not worried about this. This is all that matters. So if you saw this test, if you did a serum and you're worried about your selenium, you need to make sure you're ordering white blood cell count micronutrient, because it's, again, 30-day average. You don't get all hyped up about a serum level. Cool. So we have the EPA, DPA, and DHA. These you can find in your fish oils. EPA was below average, so I increased my supplementation at this point, but
DHA is very good.
DHA was very good.
It's really good. Probably because, I mean, you eat a ton of sardines.
I do.
Right? So you're still getting omega-3s and the DHAs and the EPAs in that. So that's probably why. But think about that. Even as much of those as you eat, you probably eat a couple cans a week.
Yeah.
Still need more.
Still need more.
You know, people really think that they're getting enough omega-3s and they're not.
They're not.
They're not. You need to eat multiple servings of fish per week, and then probably still some additional quality fish oils to get that omega-3 high enough. Because even if you are, like, as best as you can avoiding seed oils, like you're not going to restaurants, or you're not going to restaurants where you're exposed or whatever, you're still going to get some omega-6s in some of the foods you eat by proxy. Like even our meat is going to have some omega-6.
Yeah.
Eggs, they're going to have some omega, like you're still going to encounter these. So you have to buffer that by doing additional omega-3. So eating plenty of servings of fish a week, plus potentially supplementing with a really quality fish oil.
It's important too.
That's good.
We heard recently from Rhonda Patrick that omega-3 deficiency is as bad as smoking.
Yeah. I think there was something she said about if you take one person that smokes, but they have a good omega-3 profile, and you compare them to somebody who doesn't smoke and has a poor omega-3 profile, the person that smokes but has a better omega-3 profile will live longer.
Yeah.
So that just goes to show you how important that is. It really, really is.
Gotta check your omega-3s.
And unfortunately, the one thing I disagree with too in a lot of these like carnivore and keto communities is they don't care about omega-3, EPA-D. They don't care about fish, a lot of them. I mean, some of the carnivores do, but then there's some that are like lion diet hardcore. They avoid, and it's like you're not going to get enough omega-3s even if you're eating quality grass-fed, grass-finished beef. You're still not going to get enough.
No, you'll get some.
Yeah, you'll get some, but you won't get enough. You'll still probably have a low index, which is a risk factor for cardiovascular disease.
Yep.
Linoleic acid, that's pretty good.
It's low.
Yeah, you don't want that one too high though.
No.
That one is also usually from a lot of vegetable oil intake, or not. I shouldn't say vegetable oils, but omega-6 fats, because that's not just vegetable oils. Omega-6s are in a lot of different things, but they're high in vegetable oils.
Mm-hmm. Yeah, I usually see that in whatever test I do, is that I'm low in the
linoleic
acids.
Yeah.
It's because I avoid the seed oils.
Mm-hmm.
Arachidonic acid, 17.6. Not bad.
Not bad. That one, I think you're probably in a good range. You obviously don't want to see that in the red because arachidonic acid is also an inflammatory mediator. And so people that eat too many omega-6s, they're going to have a high arachidonic acid ratio because it's a byproduct of that.
Isn't it also a marker of being overfed?
Yes. Yes. So it can be a marker of eating too much.
Eating too much.
But yeah, I would say yours is okay. Obviously, it's not in the red. It's kind of at the high end, but still in the considered the reference range.
Mm-hmm.
Omega-6, I think that's probably really good.
Yeah.
Because you're right at that midline. So that's good. You're definitely not eating too many omega-6, which is also good because that means hopefully most of the meat and eggs that we're getting, although they're going to have some, again, most meat, even the best quality, still going to have some, but hopefully that means the poultry and meat we're eating is relatively low in omega-6, which is good.
Yeah.
So
arachidonic acid and EPA ratio is high. Oh well. Omega-3 index, good.
That's really good.
Yeah. That's what I'd like to see. What else we got here?
Oh, it's kind of just a breakdown.
Oh, just a breakdown.
Like how it gets depleted.
Yeah, as I said, it's critical for NAD pathway.
Well, and then again, I think we were looking at too, your riboflavin was on the low end, and that's a cofactor for B3. So again, you have to remember too, some of these build on each other. So you might be deficient in one thing because you're deficient in something else. And you have to look downstream to see what may be that initial offending agent, replace that, and then that might bolster the rest of your labs.
Yes.
Because remember, your riboflavin wasn't necessarily low, but it was kind of on the low end.
Mm-hmm.
So if you're low in that, then by proxy, you might be low in B3.
Oh yeah, it will also lower triglycerides and LDLs, which that's another lecture, and it did that as well with my supplementation.
Which, go back up too. So it's giving you the food sources too. And to be honest, you know, we don't eat a whole lot of pork. We do eat some. We occasionally have bacon, but we don't, that's not really our main animal source of food. We eat mostly beef, fish, and chicken. We don't eat peanuts. We rarely ever eat tofu. We do eat eggs. So if you think about it, out of the food sources, yes, you're eating eggs every day, but it may not really be enough to give you enough niacin to optimize. So you look at that type of stuff.
Yeah, severe deficiency of niacin is called pellagra, but what is it? Dermatitis, diarrhea, dementia, and death. It's kind of interesting because it's like a severe deficiency, but this lecture I described previously, it's like we're seeing perhaps a subclinical niacin deficiency in the population, or more, I should say, NAD precursor deficiency in the population.
It could just look like rashes, cognitive issues.
Yeah.
Have to think about that type of stuff.
Here, I think what it's just showing is the things that were off, but it's kind of like a nice diagram.
Yeah, and then talks about too we talked about like the methylation, some genetic SNPs may make it more difficult, so that requires not excess, but extra B12 supplementation.
Vegans will have B12 deficiency, so they need to watch that.
And then remember, we looked at your MMA, right?
Yes.
So remember I talked about that. In B12 deficiency, methylmalonic acid will be metabolized to MMA, which is why MMA is considered the definitive marker for B12 deficiency. So again, you're not going to find this in the LabCorp test. I mean, I guess maybe you could test for that, but this is an even more important marker. If that is low, which yours was, heck, you still need more B12.
I do.
And you wouldn't know that because you're going to test on LabCorp and it's going to be 1,000 because you're supplementing and you're going to think that you're getting enough, but in actuality, you're not getting enough. And then again, we think of for women, this is really important. If women aren't methylating well, that can lead to a whole slew of problems with their future children.
And it's just saying insufficient stomach acid can lead to B12 deficiency.
Mm-hmm. Yeah, and that's we kind of know that from school. Yeah. They did talk about that.
A lot of people are taking the acid blocking medications. They need to be careful about that.
MTHFR genetic and methylcobalamin supplement, particularly with hyperhomocysteinemia. That's an important thing too. If somebody is having an elevated homocysteine, they need folate, they need B12, probably NAC too, but you got to get them folate and B12.
Yeah.
That just goes to show a B12 and folate deficiency, which seems so simple, that can literally cause somebody to be demented.
Yes.
You know, it's crazy.
Craziness. B12 may help manage anemia, asthma, fatigue, hepatitis, dementia, epilepsy, depression, psychosis, irritability, ataxia, numbness, tingling, neuropathy, AIDS, multiple sclerosis, tinnitus, and infertility. Pretty important.
Yeah, glutathione is required for B12 as well. So again, it's all these downstream factors you have to look at. Remember, your glutathione was suboptimal too.
Yeah, it was.
So it's all about correcting at that very what's the word I'm looking for?
Microscopic level?
Yes, microscopic level.
Zinc, it brought up zinc because of the odd serum level. How does it deplete it? Insufficient dietary intake, and those who rely heavily on cereal grains for caloric intake, and they'll get high levels of phytic acid impairing the uptake of zinc.
Which, fun fact too, it's not the grain in particular. So phytic acid can be lowered, like for example in rice. If you soak the rice, you're going to remove the phytic acid. If you make sourdough, that active culture, that wild yeast, is actually going to reduce that phytic acid level dramatically. So it's also about how about it's prepared, right? So if you go to the store and buy bread, yeah, it's going to be really high in phytic acid levels, and it's probably going to take some of that zinc. So you have to think also of how it's prepared. Not all grains are made the same.
Zinc deficiency causes delayed growth and sexual development, decreased immune function, altered sense of taste, hair loss, pregnancy, complications, and gastrointestinal distress.
Oysters, beef, and clams.
Yeah. Oysters, beef, and clams. Yeah. Yeah, be careful with zinc supplementation. It can cause a stomach upset if you take too much. The Phyto Multi supplement has approximately, I think, 15 milligrams in there, which is a good dose, I think. Whoa. I think that's, what else? Selenium. Oh yeah, I think talk about selenium. So you can get too much selenium. Don't do too much, about 150 micrograms, max like 200, maybe 300 micrograms a day. You can get toxicity from that. It doesn't have those competitors that iodine has. It's not in the halogen column of the periodic table, so it doesn't have like super big competitors like iodine has. You don't need too much of that, and you're gonna be just fine.
And look, here's another downstream effect. Remember, your vitamin C and vitamin E were kind of suboptimal.
Yes.
Again, you need selenium to regenerate the C and the E.
Yeah.
So again, it just goes to show you have to be on point with all of these, because the minute that one thing is low or high, it's downstream effects for something else. Or I should say it's an upstream effect for something else.
People will say they need to eat Brazil nuts to get selenium, but I say be careful with this, because we've identified that these Brazil nuts have more bromium than selenium in them.
And plus, there's also plenty of other options.
Yeah. I really just recommend it as a supplement rather than trying to get it through the Brazil nuts. But yeah, it's also antiviral. It's been implicated in the mouse mammary tumor, breast cancer. So supplementing with selenium can decrease the breast cancer risk along with iodine. What else do they talk about? Clinical manifestations of deficiency. Low selenium intake may decrease ability to fight viral infections. Yeah, it is antiviral.
Decrease conversion of thyroid hormones.
Yeah.
Decrease antioxidant regeneration.
Decrease action of glutathione.
It's all these tiny little minerals that make all the difference.
Can cause heart enlargement in deficiency. Interesting. Let's see what else. Okay.
It's just a glossary.
I think that's it.
Yeah. It's pretty comprehensive.
So this is the test. It costs about $400 plus the lab draw fee. I think this is the way to go for assessing micronutrients. Now, who might want to do this? Really, everyone. Like the nutrition is the building block of health, and in its absence, you're going to get all disease states. So in modern medicine, they look at the disease state rather than thinking about how to prevent it or what's the cause of it, right? Take, for example, what we described earlier with calcium plaquing of the arteries. You get a CAT scan, it shows calcium plaquing of the arteries. It's like, oh, what's going on? Maybe you need a statin drug. Statins might actually precipitate more calcium plaquing. It's
like a reflexive, like algorithmic way of thinking.
Yeah, statins deplete K1 and K2 actually. So it's been associated with, statin therapy has been associated with more calcium plaquing of the arteries. So, but K1 and K2 deficiency is probably the cause. If you're looking at all the Danish studies coming out, K1 and K2 deficiency may be the actual cause of coronary artery calcium plaquing. Instead of saying, oh, we don't know why Alzheimer's happens. Well, there's clear nutritional reasons why Alzheimer's dementia may happen. And instead of targeting the end disease stage process, which is, oh, we got to develop a pharmaceutical to target tau proteins in the brain, to stop these amyloid plaques from forming. None of these pharmaceutical drugs
it's so behind the mark. Yeah, it's so behind the mark.
They cost a lot of money. They do absolutely nothing other than give the patient side effects. When you can, before Alzheimer's sets in, if you had this test done 30, 40 years ahead of time and you optimized your nutrients, the Alzheimer's would never manifest 30, 40 years later.
Yeah.
What other examples? I mean, there's endless examples of chronic fatigue. Oh, everybody has chronic fatigue nowadays. Yeah. You get them on the right nutrients, and the fatigue, it goes away. We see this all the time at Iron DPC.
And it's so basic. It's so easy to just replace nutrients.
Yeah. I mean, if you don't have money for a $400 test like this, we have a certain supplement protocol that works very well. You can find it in the link in the description of this video. You start taking it, and you feel great. But I was taking that protocol, and I still had deficiencies. If you really want to optimize, you have to do really detailed testing and look at what's going on under the hood. And a serum test is actually not useful, and it's not cheaper. If you wanted to get all these testing done at, say, LabCorp or Quest, God forbid you tried to use your insurance for that, you'd get a bill for like $3,000 in the mail.
Probably more, honestly.
Probably more.
They would never cover something like this.
It would also never measure a white blood cell micronutrient count. That does not happen. You get all of this done. It's a crazy amount of information.
It really is. Once we sit down and go through it, it's pretty impressive.
So this is what I would recommend for patients who really want to look at what's going on the hood. Both in disease states and preventing disease states, optimizing fertility, the list goes on and on. Nutrition is the start and end of all diseases.
Well, yeah, we should start doing this type of stuff before we jump to EBV testing and then testing everyone and their mother for mold. Like, not that these things don't exist, but like sometimes it's not the mold, or it's not like this, what we call it, esoteric type of mystery illness. Sometimes it's just you're deficient in a lot of things that you think you're not because you think you're eating a good diet.
Correct.
But it's not enough.
Even in long COVID and even the
Yeah.
vaccine injury. I've been dealing with this for now 3
Yeah.
years. It often comes back to the diet and their nutritional status.
Yeah.
Why they got the problem in the first place. Sure, they maybe shouldn't have gotten the vaccine in the first place, but the disease itself, they don't detoxify well.
Mhm.
They manifest more of the disease
Mhm.
from these chemical burdens. So you layer on the chemical burdens. You got fluoride, chlorine, you got a vaccine, maybe you got wild type COVID.
Mhm.
You have a low grade EBV that you were exposed to 15 years ago.
Mhm.
Maybe you got a bit of Lyme. A lot of people will test positive for Lyme. EBV, perfectly fine. What separates these people from the people who get terrible disease manifestation from it? Nutritional status,
Yeah.
antioxidant status, vitamin C,
Well,
B vitamins.
that's just like me with my parasite, and we'll talk about that
Oh,
later.
yeah. All right, I think that's it for now. Hope you guys enjoyed.